Okay, so you've given us a really interesting and quite sensitive set of sources this time, focusing on genophobia.
Mm,
For anyone listening who hasn't come across that term, genophobia is also known as codophobia or even erotophobia.
right, and that eroto part, it actually links back to Eros, the Greek god of desire, which is, quite telling.
It is, isn't it? So essentially, it refers to this really powerful fear, whether physical or psychological, of sexual relations or sexual intercourse specifically.
And it's crucial to understand this isn't just feeling a bit awkward or nervous.
You know,
The materials you shared describe it as something that can trigger like intense panic, really akin to a full-blown panic attack.
wow. And you can just imagine how something like that, that deep-seated fear, could really impact someone's life, right? Creating massive hurdles in relationships.
Absolutely. And potentially leading to quite profound feelings of loneliness, unfortunately.
So looking at the words themselves, you mentioned quitophobia. The sources break down the etymology a bit.
They do. Genophobia apparently comes from the Greek genos, meaning offspring, very
Hmm.
interesting, and phobos, well, that means fear.
Okay.
And coidophobia comes from coitus, simply meaning copulation. So the names themselves sort of point to this deep fear around sexual intimacy.
Right. So I guess our goal here in this deep dive is to really dig into this based on the information you provided, try and offer some clarity.
Exactly. Shed some light on what can be a very isolating and frankly scary experience for people.
Okay, so let's start with the experience itself. What does it actually feel like? What are the signs, the symptoms mentioned in the sources? Understanding that seems key.
Definitely. The sources list quite a range, both emotional and physical, intense feelings of panic, obviously, but also terror
Oh,
and
yes, you said
dread.
okay.
Yeah, and physically. You're
Mm.
looking at things like a racing heart, shortness of breath, trembling or shaking,
So
sweating.
very physical manifestations.
Very physical, even crying sometimes. And of course, a strong tendency towards avoiding situations or people that might lead to intimacy.
That paints a very clear and distressing picture. So what leads to this? What causes genophobia, according to the sources you looked at? They seem to point to some really significant origins.
They certainly do. And one of the major factors highlighted is a history of sexual assault or abuse.
Right. That makes sense, sadly.
These are experiences that fundamentally violate a person's trust, their sense of safety, their self-determination. One source even calls rape the most extreme possible invasion of a person's physical and emotional privacy.
That's a powerful description.
It is. And that kind of violation can understandably lead to very long-lasting emotional reactions, sometimes called rape trauma syndrome. That fear gets deeply embedded.
It's not just the assault itself, is it? I think the sources also mentioned how the response someone gets afterward can play a role.
That's a really critical point, yeah. The reactions from, doctors, police, even family and friends, if those reactions are negative or dismissive,
It could make things so much worse.
it absolutely can. The sources suggest it can worsen feelings of lowered self-esteem, helplessness, shame. It sort of compounds the initial trauma.
So a lack of validation or even blame could directly contribute to entrenching that fear of sex.
Precisely. Plus, you have the potential physical aftermath of an assault, things like soreness, bruising, pain, maybe infections.
Hmm.
That creates a very real physical association between sex and pain or trauma. So you've got the physical trauma, the mental anguish, and then potentially this negative social response all tangled up.
It's incredibly complex. The sources also brought up child molestation or child sexual abuse as another potential route. That
Yeah.
seems devastatingly impactful.
Absolutely devastating. The sources define it, as an adult or even an older adolescent abusing a younger child for sexual gratification.
And it's not always intercourse, right? The sources mentioned other forms.
Correct. It can include things like inappropriate talk about sex, showing pornography, forced participation in acts, exposure, fondling, a whole range.
And critically, I think the sources noted, force isn't always used.
That's right. Children might cooperate because they don't understand, or they feel intimidated, or perhaps groomed by the abuser. It doesn't make the abuse any less harmful. The betrayal of trust is immense.
And the impact, it might not surface immediately.
Often it doesn't. The sources talk about a delayed emotional impact. As someone gets older, they start to process what happened, understand the violation.
Right. The invasion of privacy, the betrayal.
Exactly. And that realization can lead to long-term psychological trauma. Deep distrust of others, huge difficulties with intimacy, vulnerability, which, can definitely manifest as a fear of sexual intercourse later on.
It's interesting how that delayed processing might mean the person themselves doesn't immediately connect their current fear to that past trauma.
That can definitely happen. It makes diagnosis and treatment potentially more complex.
Okay, so beyond these really traumatic experiences, what else did the sources point to? They mentioned insecurities as well.
Yes, personal insecurities are definitely discussed as a contributing factor. Things like body image issues can play a significant role.
Oh.
Well, someone might be intensely self-conscious about their body shape or specific parts of their body. The sources mention worries about, say, the appearance of labia for women,
Okay.
or concerns about erectile dysfunction for men, things like that. Also, gender dysphoria was mentioned as something that could potentially underlie or contribute to a fear of
Oh,
intimacy.
that makes sense. Feeling fundamentally uncomfortable in one's body could easily translate to anxiety around sexual situations.
For sure. And you have to wonder how much societal pressures, media portrayals of the perfect body feed into these insecurities and maybe indirectly contribute.
That's a good point. And the sources also seem to link genophobia to other fears, like it doesn't always exist in a vacuum.
Right, exactly. Phobias can be interconnected. The sources brought up things like nosophobia, that's the fear of disease.
Ah, okay. Fear of STIs, perhaps?
Potentially, yeah. Also gymnophobia, the fear of nudity, and even just an extreme fear of being touched, like a tactile sensitivity issue.
So pre-existing anxieties can kind of bleed into the sexual sphere.
It seems so. General stress disorders were also mentioned. It suggests that sometimes genophobia might be an outward symptom of these broader, perhaps deeper-seated anxieties.
Which raises the question, maybe addressing those underlying fears could help with the genophobia itself.
It's certainly possible and likely a focus in therapy.
Speaking of therapy, if someone is dealing with this, what kind of help is out there? What did the sources say about treatments or coping?
Therapy is definitely the main recommendation. Seeing a psychiatrist, psychologist, or a licensed counselor is highlighted as really important for anxiety disorders in general, and that includes genophobia.
Makes sense.
Therapy can help unpack the roots, whether it's trauma or insecurities, and develop coping strategies.
What about physical pain, if that's a factor?
Good question. The sources do mention seeking medical help, seeing a doctor or maybe a gynecologist, especially if there's pain during sex, to rule out or treat any underlying physical conditions.
Okay. And medication, is that ever used?
It can be. Medication might be prescribed, usually alongside therapy, to help manage the anxiety symptoms, make them less overwhelming.
So a multi-pronged approach seems common. Therapy, possibly medical checks, maybe medication.
Exactly. It depends on the individual and the specific factors involved.
The sources you shared even mention a film, a cultural reference.
They did, yeah. An independent film from 2008 called Good Dick,
Good dick, okay.
directed by Mariana Palka. Apparently, it centers on a character with genophobia and explores how it impacts her life and relationships. It also indirectly touches on incest as a potential underlying trauma.
Interesting. So a fictional portrayal, but maybe offers some insight into the experience.
Potentially, yes, as
Yeah.
a way to see some of these dynamics play out, perhaps.
And finally, just briefly, the sources touched on a couple of other terms. Asexuality and corrective rape. How do they relate?
Right, they were mentioned as related concepts. It's important to distinguish them, though. Asexuality, as the source notes, is about a lack of sexual attraction, which is very different from genophobia, which is a fear of sexual activity.
Okay, different concepts entirely.
Entirely.
Yeah.
And corrective rape, well, that's a completely different and horrifying thing. It's this vile, false idea that raping someone can change their sexual orientation or gender identity. It's mentioned, I think, just to situate genophobia within the broader complex landscape of sexuality, orientation, and sadly, sexual violence.
Understood. So just related terms flagged in the sources, but distinct issues.
Precisely.
Okay, so wrapping this up, it's clear genophobia is really complex. A deep-seated fear with roots that can range from severe trauma,
Like sexual assault or child abuse.
right, to maybe personal insecurities, body image issues, or even other connected anxieties and phobias. And understanding those potential causes and knowing that there are ways to cope, ways to get help through therapy and other support, that seems incredibly important.
Absolutely crucial.
This deep dive, based on the sources you provided, was really about trying to get a foundational understanding, bring some clarity, and maybe challenge some misconceptions around what sounds like a really isolating condition.
Definitely. And maybe, considering everything we've touched on, the diverse origins from really violating trauma to maybe more subtle insecurities, it leaves you with something to think about.
Oh,
Yeah, like what might be the broader consequences, societally speaking, if these kinds of sexual anxieties and fears in all their forms aren't really acknowledged or addressed.
Hmm.
Think about the ripple effects on individuals, sure, and their relationships, definitely, but maybe even on how we as a society talk about and understand intimacy, consent, connection. It's all interwoven, isn't it?
That's a really potent final thought, the wider impact of these deeply personal fears.
Mm.
Something for us all to consider.